Good day, ladies and gentlemen. My name is Ibrahim Tobba, and this is Introduction to Force Resolution. But before we go into our biomechanics topic, we need to explore what's the cause-effect relationship. If I see a girl carrying an umbrella just because it's raining, this is a cause-effect relationship. The action of carrying an umbrella is an effect. There is a cause to it. Maybe there is multiple other causes. Maybe it's sun, too much sun. Maybe she's selling them. Maybe she's just carrying it for later. Okay? But what we know for sure in science, there is always a cause. Without a cause-effect relationship, there is no science. Now we're going to take that cause-effect relationship and apply it to disc prolapse. What's a disc prolapse? إذا غضروفي بالعربي. It's weakening, relaxation, or overstretching of the disc walls, eventually leading to teeth. As we can see on the left side of the picture, there is weakening of the disc wall with bulging forward material. On the right side, we have in the middle disc another representation of the disc bulge. Okay. Now we're going to explain disc prolapse as an effect, not a standalone existence. To do that, we need to identify the psoas major muscle, which muscle connecting the spine to the hip. This muscle has two actions. The first is flexion of the trunk. When this muscle contracts, it moves the trunk forward. The second is flexion of the hip. When this muscles contract, can move the thigh bone, the femur, forward. Let's represent the force produced by the line. Let's just draw it in a form of an arrow. This arrow is called line of pull. So the orange yellow represents how the force of the muscle is generated, the line of pull. Now let's put the psoas major aside and look at the next picture. We have here a dog tied up with a leash and chain. If the dog starts to move forward, the leash and chain will stop him. If the dog starts to sit down, the leash and chain will stop him. We can reimagine this chain into two chains. One is horizontal, preventing moving forward, and one is vertical, preventing sitting down. So we can, as we have drawn with the orange arrow, can represent the line of pull. What we have done by breaking the chain into two chains is called force resolution. Force resolution is analysis or breaking down a force into vertical and horizontal components. Now we know what's the cause-effect relationship, we know disc prolapse, we know what's psoas major and what's force resolution. Now let's combine them. Force resolution of the psoas major can be created or described into two components. The first is horizontal, which is the main action of the muscle, trunk flexion, moves the trunk forward. The second one is vertical component. The vertical component produces compressive force on the spine. Which structure absorbs these forces, act as a spring within the spine, are the discs. So in normal individual, they are not complaining of any pain. They have compressive force generated on the spine by the psoas major and absorbed in the spine by the discs. Okay, this is completely normal to this point. What's abnormal is shortening of the psoas major. If an individual, there is many causes to it, it's not our topic right now, but the end result, there is shortening of the psoas major muscle. It will produce excessive compressive force. The compressive force will gradually weaken, damage the wall, stretching it, and eventually reducing tear. This patient will have back pain that increased with standing. As the patient starts to extend the hip to reverse the action of the psoas major, stretching the psoas major backward, more compressive forces are generated on the spine. Compressive forces will be absorbed by the discs, causing disc pain. So this patient will have pain more in standing and in walking. Okay. Now, this condition is known as psoas major syndrome. So the disc prolapse, which common diagnosis, now is described as an effect to another condition, the psoas major syndrome. Let's use the cause-effect relationship to produce a treatment for this form of disc prolapse. It's very simple. If the cause is short psoas major, just stretch it. For this patient, treatment will basically be stretching of the psoas major as a main part of his or her physical therapy treatment program. Okay. Okay, let's recap what we have learned yet. First of all, we have learned or discussed the cause-effect relationship, how every action is not by haphazard existence, it happens by a cause. We described the psoas major muscle and the disc prolapse. We identified and explained the force resolution process. We utilized the force resolution to analyze forces of the psoas major and how it produces vertical compressive force on the disc. We utilize the cause-effect relationship and the force resolution to explain excessive compressive force on the disc, how it produces disc prolapse, lengthening, and how to deload, decompress the disc. Simply treat the cause so the effect goes away by stretching of the psoas major muscle. Thank you for your time.